if we are not respecting where the system's at right now and what place everything has, every part of medicine, what place it has in medicine, then I think we'd just be foolish. All right, everybody. So another episode here at the curbside. We're at a different curbside today. Not at my clinic, I am at the hospital. Just finished up 6 weeks shadowing an orthopedic spine surgeon here in the Valley. Did rotation with him in clinic and also in the OR. And the amount of things I've learned is staggering. And, you know, I got a lot of questions while I was in there from staff, other docs, just, you know, what was a naturopathic doctor even doing in the OR? Because that's not our place. And I'm very upfront about that. And no one has ever tried to claim that. But one of the biggest reasons for me on doing this was it allowed me the opportunity to see things from a different angle, right? So in the regenerative injection space, you know, I'm putting needles into people, and that always comes with a risk. And so for me, having an understanding, a different understanding of how do things look from a different point of view, through a different lens, through a different system, but also literally how do things look. So being able to have the spine open and look at the spinal cord, look at the epidural space, look at how the facet joints are layered, all this type of stuff helps my mental construct of what I do in order to allow me to do a better and safer job. And so, you know, there's always complications with things that happen, and was privileged to learn some things in regards to that in case something similar ever happens in my patients, that I'm better suited to be able to do so. And one of the other big things that I really took away from this is that, one, we really have to respect and appreciate where the system is at right this second. So yes, an ideal system is that we have things available for patients like perineural injection, nerve hydrodissection, prolotherapy, PRP, maybe even autologous stem cell therapy before surgery for some people, right? But for other people, you know, that's not always going to be the case. And some people are at a place, whether it's a traumatic injury or just neglect in terms of not going to see a doctor, that surgery is indicated. But right now in the system where we're at is that these surgeries, majority of the time, help a lot of people. Yes, there are failures. Yes, there are complications. Yes, there are people who end up worse off, unfortunately, but that is the practice of medicine. And we just have to be cognizant of that and not let this pendulum swing too far on that, oh, surgery is the devil, medication's the devil, opiates the devil. Well, they may not be the best, but at this time, they serve a purpose. And until we actually evolve into the next phase of medicine, you know, it's what we have right now, and there are people suffering. And if what helps a patient resolve their pain is surgery, I'm happy, because that patient is no longer in pain, no longer suffering. And sure, there might have been other things that could have been done prior to that differently if the system was different, but we can hum and haw over that all day long. If we are not respecting where the system's at right now and what place everything has, every part of medicine, what place it has in medicine, then I think we'd just be foolish. So those are just my thoughts after 6 weeks in shadowing spine surgeon in the OR. All right, everybody. See you later.